Hello everyone, welcome back to our fire nursing tutorial YouTube channel. In this class, we are going to discuss with MCQs. Important. First question is, bacteria causes rheumatic fever. Here, these are the options. Right answer is Streptococcus pyogenes. We'll move to the next one. What is the most common cause of peptic ulcer disease? Here, these are the options here. Right answer is H. pylori infection. We'll move to the third one. Which vitamin deficiency causes rickets in children? Here options are given. Right option is vitamin D. We'll move to the next one. What is the classic symptom of Parkinson's disease? Here the options. Right option is resting tremor. We'll move to the next one. Which disease is also called Hansen's disease? Here the options. The right option is leprosy. We'll move to the next question. Which virus causes chickenpox? Here the answers are given. Right answer is varicella zoster virus. Next question is, which mosquito spreads dengue fever? Here the options. Mosquito. We'll move to the next one. What causes tetanus? Here the options are given. Right option is Clostridium tetani. We'll move to the next one. What type of disease is psoriasis? Here these are the answers. Options. Right option is autoimmune. It's an autoimmune disease. We'll move to the next one. Which disease is known for butterfly rash? Here are the options. Right option is lupus. We'll move to the next one. What is the cause of whooping cough? Options are given. Option is Bordetella pertussis. We'll move to the next question. Which vitamin deficiency causes scurvy? Here the options are. Right option is vitamin C. We'll move to the next question. Which parasite causes malaria? Options are given. Option is Plasmodium. We'll move to the next one. Which causes cholera? Here are the options. Right option is Vibrio cholera. We'll move to the next one. What is the main sign of jaundice? Here are the options. Right answer is yellow skin and eyes. Next question. Which is a fungal lung infection? Here are the options. Right option is histoplasmosis. We'll move to the next one. What is the mode of transmission for hepatitis A? Options are given. Oral route. We'll move to the next one. Which condition is known as German measles? Here are the options. Right option is rubella. We'll move to the next one. What disease causes Koplik spots? Here the options are given. Option is measles. We'll move to the next one. Which disease is linked to insulin deficiency? Options are given. Right option is diabetes mellitus. We'll move to the next one. What is the main cause of tuberculosis? Options are given. Here, right answer is bacterial infection. We'll move to the next question. Which organ is mainly affected in hepatitis? Options are given. Your correct answer is liver. We'll move to the next one. Which deficiency causes night blindness? Options are here. Right options vitamin D. We'll move to the next one. Which condition is caused by Plasmodium vivax? Here are the options. Right options malaria. We'll move to the next question. Last question. What is the cause of diphtheria? Here the options are given. Corynebacterium diphtheria. Please like, share and subscribe to my YouTube channel for more informative content. Thank you for watching.